Hello everyone, this is me Sneha. Today's video is all about blood culture, collection and transportation. Before diagnosis, before treatment, it starts right here with perfect blood culture collection. Blood culture is a crucial test that helps us detect infections in the bloodstream. From collecting the sample carefully to safely transporting it to the lab, every step matters. So, let's learn how precision and care come together to give accurate and life-saving results. Let's see how the collection of blood culture works. The foremost step is the preparation of site. The site of venipuncture should be selected, and always remember to wash the site with soap and water if found dirty. Around 3 to 4 inches around the venipuncture, apply a tonic vein. Wear examination gloves and cleanse using 7% isopropyl or ethyl alcohol so that the dirts are removed. Scrub the site with cotton and allow to dry. Wipe 2% chlorhexidine with 70% isopropyl alcohol in circular motion. Then allow it to dry for 2 minutes. After cleaning, remember not to touch the site. Next, collect the blood sample using needle and syringe. Release the tonic vein and withdraw the needle. Apply pressure to the site with a sterile cotton ball and place a band-aid. The skin preparation with alcohol or tinge of iodine leads to lower the blood culture contamination than the use of povidone iodine. The blood collection of pediatric patients hits different. Let's have an eye into that. Tiny patients, tiny veins, but huge responsibility. That's pediatrics blood culture for us. If the heroes are less than 2 months, the iodine step can be omitted. Instead, use separate pads saturated with 70% isopropyl alcohol or ethyl alcohol and clean additionally twice. If the heroes are about 2 months, chlorhexidine gluconate can be used as skin antiseptic. Now let me talk about the blood collection through intravenous line. Blood collection can be collected through a peripheral intravenous line. But in this case, there is a higher risk of contamination compared to drawing from a peripheral vein. In this case, it's not necessary to discard the initial volume of blood or flush the line with saline to eliminate the residual heparin or other anticoagulants. Wipe the septa using 70% alcohol and let them dry for 30 to 60 seconds. After the blood collection, the next process is transferring the blood to the bottles. Let's discuss about the types of bottles. The first category is automated blood culture bottles, which are used in systems like Bactelert, Bactelert 3D. There are different varieties of bottles under the automated blood culture system. The first group is aerobic bottle, which having a green cap. These are used for the bacteria that grow in the presence of oxygen. For example, Pseudomonas, Staphylococcus aureus. And the next category is anaerobic bottles, which having orange color cap. These are used for the organisms that can grow without the presence of oxygen. Example, Clostridium. And the third group is pediatric bottle, which comes under yellow color cap. And these are used for smaller blood volumes, used for infant and children. These bottles contain nutrient-rich broth and a carbon dioxide sensor at the base. The next category of bottles are conventional blood culture bottles. These are usually plain sterile bottles or tubes containing certain broths. The types of media used in manual blood culture bottles are tryptic soy broth, brain heart infusion, thioglycolate broth. In case of conventional blood culture method, the blood culture for bacterial infections should be carried out in 2 bottles containing 50 ml each tryptic soy broth and bile broth. The preparation of bottles are crucial in blood culture collection. The initial step is to prepare the septum and rubber stoppers on bottles. A tiny sticker can make a huge difference. So, always label your blood culture bottles. Label the bottle with patient's name, date, time of draw, and also with the site of draw. Mentioning the site, whether from central line or from peripheral venipuncture, gives more sense. Big bottles for adults, tiny bottles for our little heroes. But precision matters in both. So, pediatric bottles should not be used for adult patients except for those elderly patients in within it is difficult to obtain larger amount of blood. For adult, 10 to 20 ml of blood is collected, which is divided between two blood cultures from separate peripheral venipuncture sites. And in case of pediatrics, 6 to 10 ml is collected, divided between two blood culture bottles. Let's look forward to the timing of blood culture. Always note that the collection of blood before antimicrobial administration is followed. The volume of blood collection should be given more importance than the timing. Mix the bottles thoroughly to avoid clotting. Last but not least, let's discuss about the transportation of blood culture. A safe journey ensures a true story. Blood culture transport matters. In case of delay between the collecting and processing process, never refrigerate the bottle. It's preferred to keep the bottles in 35 degrees Celsius incubator, otherwise advised to leave at the room temperature. Proper blood collection and transport aren't just routine steps. They are the heartbeat of accurate diagnosis. Remember, a small drop collected with care can reveal the unseen world of pathogens. So, handle every sample like it's a story waiting to be told. Because in microbiology, every colony counts. Alright, my lab buddies, thank you for your valuable time. See you in the next Micromagic video only on Medical Guruji. Thank you and bye-bye.